Speech pathology is also known as speech therapy, and it is the diagnosing and treating of speech, language, voice, communication, and swallowing disorders plus more. Speech language pathologists are the specialists who work in these fields, and then they also work with speech pathology assistants who work under the supervision of SLPs to provide information and help perform procedures to patients. Some of the disorders that are treated by speech pathology include language disorders, which involve difficulty reading and understanding what others say, one example of this being aphasia. Then there's also speech disorders, which include trouble verbalizing, producing sounds, and examples of these include stuttering and tongue ties. Voice disorders are the trouble of producing speech due to issues with the vocal cords, and this could be due to vocal cord paralysis or vocal cord dysfunction. Lastly, SLPs also work to address swallowing disorders, social communication disorders, and fluency disorders. And then the type of patients who are treated by SLPs are of all ages from infants to adults, and then these patients need speech therapy, and this might be due to congenital disorders, which are disorders they're born with, or acquired disorders or intellectual disabilities. Some of these include cleft lip, autism spectrum disorder, a stroke, tumors, Parkinson's disease, and or Down syndrome.
So I'm gonna talk about past speech. So the beginning of speech therapy started at ancient times. They started acknowledging in Egypt and Greece. They were the first one who acknowledged this. And these two people wrote about problem with speech, voices, hearing. At that time, they were just starting, so they didn't have any treatments, but they were trying to diagnose it, start diagnose there. Now we go to 1800s, speech experiment, exercise, and early textbooks begin appearing for people with hearing loss, but it was kind of same for speech. Then we go, it wasn't superficial anymore, so people were start taking it serious. Now we go to 1925. It was the birth of ASHA, which means American Speech Hearing Association. They started taking this serious, they started treating it right, and it was the birthmark of therapy for speech pathology. This slide talks about in schools how they used to help kids with speech problems. They used to pull out kids from isolating them. They used to use oral motor exercise, like blowing bubbles, and they had weak evidence on that. Early therapy was clinic centers, and it was mostly isolated, and due to that, they never got the real life experience talking the outside world, so they changed this way into mostly social, whole communication, like more social people. During the disability rights movement, they had to do better in school, so they improved the speech classes. They had a community of kids working together to have a real life, natural communication that can be more effective.
So now we're going to talk about speech pathology and where we are now and how the field has changed. What do speech language pathologists do today? They help people with speech, language, voice, and swallowing. They work in various places such as hospitals, clinics, schools, and the justice system departments. They work with kids and adults across all ages. The telehealth shift, since COVID-19, they had to move to therapies online. This became the new norm. Telehealth isn't replacing in-person therapy, but it is here to stay as an option. However, there are some obstacles such as access to internet, access to devices, and comfortability being on Zoom and video calls. And yeah, that's where we are today.
We'll be speaking about speech pathology today. Speech pathology is experiencing major change. Healthcare environments have shifted rapidly, especially following the pandemic. Speech pathology practices today look very different from how it did a few years ago. The new normal is being adapted by practitioners. Services have changed from entirely in-person sessions to a mix of in-person, online, and hybrid models. Technology is now used as a routine part of assessment. Demands for services is increasing. More support is needed for clients, therefore, this is leading to more job opportunities. In order to grow service demands, additional staff is needed.
Is the assessment and evaluation. Speech language pathologists assess many things, including language, speech, communication, feeding and swallowing, and fluency. This is done by evaluating the patient's ability to talk, speak clearly, and also understand what is being said to them. In an assessment called a communication skills assessment, speech language pathologists assess three main things, which includes receptive vocabulary, which is how well the patient understands words, expressive words, which is how well the patient is able to use words, and also receptive language, which is understanding directions. They also test articulation, which refers to the clarity of speech, and also fluency, which refers to the use of filler words like or like. They'll also perform an oral peripheral examination to examine things like the tongue, teeth, lips, throat, and palate. This evaluates how well the patient performs activities like eating, drinking, and moving their lips. Treatment approaches and techniques. So treatment differs from patient to patient, and they're specific and catered to the needs of each patient based on the child's age, the severity of the disorder, and also if they're multilingual. One approach is the core vocabulary approach, which relies on the use of whole word production. A speech language pathologist practices words that the child uses on a daily basis, and they create a small list of words to practice each week. These words are then practiced until the child is able to consistently produce them. Another approach is the naturalistic speech intelligibility intervention. This uses natural interventions to help the child communicate more effectively. This includes creating opportunities to communicate during play, while at the grocery store or at a restaurant. This uses like real world experiences with the goal of improving the patient's speech. And the last one is speech sound perception training. This approach involves the patient listening to different sounds and being able to correctly identify them. This helps patients that have trouble distinguishing similar sounds, such as in words like sheep and ship, or bed and bed. Speech language pathologists may use memory games or pitch exercises to help children distinguish sounds, which overall improves their comprehension.
The future of speech pathology. Early intervention. Greater emphasis on early intervention so that children with speech difficulties are supported before school or work problems escalate at an older age. Youth rehab. Many youth offenders suffer from lower literacy rates. Advocacy for the youth in the justice system gets support with communication and literacy using therapy. Research. Large, rigorous studies on potential causes / better care methods, such as interactive technology and AI.
Why milestones matter in speech therapy. So speech therapists often go off milestone charts as this one to gauge where a patient needs to be. Communication milestones act as a roadmap. They show what skills should be present at each age, helping speech pathologists identify delays early on and what types of therapy goals they need, and also design interventions that fit each child's needs. For example, if a child isn't meeting the 2-year milestone, a therapist may help them by using simple phrases.
Speech language pathology is an underrepresented field that many people are unaware of or misunderstand. With this, there are certain myths and stereotypes about speech pathology that aren't true.
In this skit, we will be discussing these myths and correcting them.
Myth number 1 is that speech language pathology is only for kids.
Myth number 2 is that speech pathology only treats speech disorders.
The myth 3 is the kid grows out of their speech delay.
Hi.
Yes. Alright, my name is Elaine. I am the speech language pathologist assistant today, and I'll be helping you out before you see Ms. Farhall. Can you please confirm your date of birth?
June 21st, 1960.
Alright, thank you. So your chart indicates that you have Parkinson's disease and that you suffer from shakes and have trouble speaking.
Yes, I didn't know that I could see a speech pathologist. I thought that was only for like little children.
Oh yeah, speech pathology can be for anyone of all ages. So I'm glad to see you.
Oh wow, I'm so glad I can get the help I need. Thank you so much.
Hi Elaine, I'm Mrs. Rowe and I'm going to be your speech language pathologist today. I'm going to be assessing your swallowing and feeding issues.
Yeah, I didn't know that speech language pathology dealt with like swallowing issues or issues that I deal with.
Yeah, my expertise involves more than just issues with articulation and fluency.
Oh, it's very interesting. What kind of tests are you going to be performing on me today?
Today I'm going to perform an oral peripheral examination. So I'm going to examine your tongue, your teeth, lips, palate, and throat, and I'm going to evaluate how well you perform activities such as eating, drinking, and moving your lips.
Okay, yeah, I'm excited to see the issues that I deal with and then find a way to fix them.
Yeah, so this exam is going to help us understand more about the issues you're experiencing, and a common myth, as you were able to see, is that speech language pathologists deal with more than just speech disorders, and we deal with issues with eating and drinking, and as well as infant feeding issues.
Look like everybody having fun. I heard another parent says kids just grow out of their speech problem. You think that's true?
Myth. Lots of people say that, but that's not actually how it works.
So kids don't magically fix speech problems with time?
Exactly. Truth. Many kids need speech therapy to learn sounds correctly. Waiting can sometimes make it even harder for them later.
Makes sense. Makes sense. Earlier the help, better in the future.
Totally. Kids grow out of their shoes, not speech difficulties.
That's a good one. Let's get some food.